Epidemic emerged in Southern Guinea in December of 2013, spreading rapidly to Liberia and Sierra Leone. It has killed more than 11,000 people to date. Although there are no longer cases of the deadly tropical disease in Liberia and a steady decline has been seen in Sierra Leone, new cases are still emerging in Guinea. Joining us in studio today is the World Health Organization representative, Dr. Louise Barber, who will give us a later on the matter that seems to have almost disappeared from the public eye. Very good morning to you. Thank you for joining us.
Thank you for inviting me.
Is that accurate to say that this matter has somewhat disappeared from public consciousness and the media in a way?
Well, the media has paid much less attention to the Ebola outbreak. However, it's still very much foremost in the minds of public health professionals and the World Health Organization.
Now, only days after declaring the lowest number of Ebola cases in Guinea and Sierra Leone this year, officials reported 35 new cases. Just tell us, what is the current situation? Where are we in this fight? And then also, what are the challenges that aid agencies are facing in affected areas right now?
There was a spike in Guinea in the middle of May, and basically the situation now is that many of the cases continue to come from Guinea, the majority of cases, where we're facing still community resistance, widespread distribution of the cases across 5 districts in Guinea. And this particular spike could be attributed to an unsafe burial. Essentially, the community members followed traditional practices rather than allowing the public health community to be involved in the burial, thus exposing about a dozen people to Ebola.
Now, the root cause of the virus has been a point of discussion. Are we any closer to establishing the root cause? There have been a number of reports of different causes.
Mm-hmm. Most of the scientific studies now conclude that essentially there was one jump. It's a disease that is carried through animals, essentially wildlife, and we think there was essentially one contact, a single contact between a boy, an 18-month-old boy, and possibly a fruit bat. And this essentially led to the beginning of extended human-to-human transmission throughout the region. So from what we know, there was a single jump from animals to humans.
Now, in the beginning of this year, the first shipment of about 300 vials of GlaxoSmithKline's experimental Ebola vaccine have been shipped to Liberia. These were given to healthcare workers in the first large-scale vaccine trial. What was the outcome of this trial?
Well, as you mentioned in your overview, the outbreak in Liberia was declared over in, I think it was May 9th. And essentially, when we do the vaccine trials, you actually do need cases to evaluate whether or not the vaccine is efficacious. So the Liberia trial was indeed stopped, and they're discussing moving that trial to Sierra Leone or Guinea, where cases are still occurring. However, there are 2 other large-scale phase 3 clinical trials ongoing in Guinea and Liberia. Guinea aims to enroll about 10,000 people, and Liberia aims to enroll about 6,000 people. And these trials are ongoing based on essentially a slightly different modified design in light of the reduced number of cases in Guinea and Sierra Leone.
Are we heading into a future where these kinds of vaccines will become a compulsory part of people's lives in the affected areas?
Well, that's really the question. Who's going to access those vaccines? And I think that first and foremost, the health workers were given these vaccines in Guinea and Sierra Leone, in Liberia, because health workers are risking their lives caring for patients. And so health workers obviously get top priority. However, the questions about access are very complex, and there is in fact an expert working group led by Professor Helen Rees of Woods University, who's looking very much at what we do with the current information, the safety and the efficacy of the vaccines, when they could be administered, who gets priority, and essentially, particularly in light of the potential, the supply, how many vaccines we have.
How do we, and you as the World Health Organization, how do we prevent a future epidemic like this one?
Well, this is the big discussion. We just had the World Health Assembly, which is a grouping of all the ministers of the world, including the Minister of Health in South Africa, and their delegation attended to discuss this. We never want this to happen again. We had 11,000 people die in this outbreak, and all organizations involved are looking very seriously about how we can ensure that this doesn't happen again. So the World Health Organization essentially has tried to put forward a contingency fund. They've asked countries of the world to donate $100 million to be able to set aside an amount of money to be able to respond quickly to these outbreaks in the future. There's a proposal also that there's a global health emergency workforce. So a roster of people who could be on call at any minute to drop everything and attend to an emergencies. And those people would have the right skills to be able to respond quickly to this type of an outbreak in the future so it never happens again.
Could we and should we and are we going to do things a little bit differently on the ground going forward?
Yes, I think so. I think the biggest lesson is that we have to act quickly. The outbreak in Guinea took too long for the public health community to respond. It was many months before we really put a lot of resources into this outbreak. So I think the first lesson and the most important lesson is that we have to act quickly, and we have to resource the health ministries throughout the world to be able to act quickly so that they have the labs, they have access to labs, they have access to isolation facilities, and the patients can be cared for quickly and safely.
Well, I thank you for joining us today. That's Dr. Sarah Louise Barber, who's from the World Health Organization. We're talking about the response to Ebola. The latest is the War 1. What are your views at SABC?